in any intensive care unit in the United States would leave that unit completely normal 95% of the time. So in 40 years, we have come from not being able to do anything for a child to now having that child be completely normal. The problem is as this technology has evolved, the children who are smaller, who didn't make it at all, are now surviving, but they're at risk of having lifelong problems. And that is the problem with prematurity. Technology can help them survive, but they may be born or acquire problems that are going to cause cerebral palsy, mental retardation, or developmental delay. And these are things which are potentially preventable if we could stop prematurity.
So I think I do a lot of parent education throughout my life, and when you talk about some of these things, especially with young mothers, you know, teen moms, young mothers, you know, you have somebody say, you know, everything's going to be all right. If the baby's born early, Dr. Krause will take care of me. Everything will be fine. And, you know, that's you know, we don't think negatives. We think everything's going to be fine, to the point that, oh, cigarettes, I mean, how bad can it be? I mean, they can do something about that. Or, you know, drinking or drugs. You know, these things that, you know, I think part of the awareness is we know that you're great. Part of the thing that we need to learn is you can't do everything. That we are the mom. The mom has to be the great one in taking care of her body and in doing everything she can, because you're partners.
Right. Every person is different, and unlike a car that you can go in and replace a part and it's manufactured and it always fits, the human body is not like that. And the impression is that, well, my mom smoked, I'm okay, therefore my baby's going to be okay if I smoke. And you're talking about different people, and different people react to different things in different ways. And so that may not be the case. You smoking may seriously affect your child, from mild developmental delays to actually having low birth weight, prematurity, a lot of other things.
I think, and correct me if I'm wrong because I'm not in the medical profession, but I think with the smoking, you might even be able to draw the same correlation to drinking during pregnancy, in that when people used to drink prior to anyone knowing about fetal alcohol syndrome, everyone would think the same thing. Well, my mother drank when I was a baby, and, you know, I'm fine. And then we find out that that's just not the case. And probably with more research, you'll find out that with smoking, that would be the case too. I mean, we already know it's, you know, with illicit drugs, having crack babies and things like, you know, unfortunate things like that happening, smoking might be right up there too. And I think that's a very important point, that, as you brought out, you know, Dr. Krause will take care of everything, but if the mother doesn't take care of herself, that's where it really all begins. And just because something happened fine 20 years ago does not mean it's going to happen fine today.
March Dimes made outstanding progress, and yet the statistics aren't going down like they should be. So therefore we do need to have a great deal of education. And the education isn't just of the families, it's also of the professionals. Dr. Krause, you want to talk a little bit about how we go about educating? I know you have a wonderful, March Dimes has a web page that has curriculum and, you know, handouts and, you know, a lot of things, but how do we educate professionals? You're a doctor, you already know about these things.
Well, the March of Dimes partners with many different organizations to provide information in many forms. One is leaflets. There are leaflets that go out to physicians' offices, to nurses, to hospitals, that just bring people aware of new things that are going on, things that they need to be aware of, that their parents and patients may need to know more about. There are conferences that are supported by the March of Dimes, also by the perinatal system within the state, where, again, we talk about prematurity, we talk about baby's health, and then there are programs that are nationally organized, the prematurity program itself. And so, again, there's a tremendous amount of partnership, and we all have to go ahead and do what we can to get the word out. And I think that the more that we can work together, the more that these organizations can get out and reach our target audience, hopefully the better we'll all be.
Well, and it's a wonderful thing that you are involved with March of Dimes, because you do bring that expertise and then also link the all the services back to the professionals. And when we talk about it, it's not just doctors, it's nurses and, you know, public health departments and, you know, within school nurses and parish nurses and, you know, anybody that can help. You don't need to have a degree to spread the March of Dimes word.
And that's, as being on the board, that I couldn't have said it any better, Pat, than you just said. We're always looking for volunteers. Anybody who has an interest in this, or who have a woman of childbearing age, a man who is interested in becoming a father, people who've had premature babies, or somebody who just wants to be involved in something that's a very, very good cause that's going to help people. We are always looking for volunteers. We have lots of fun events. Our Walk America event is coming up at the end of April, and that's always a good time. That really gets the word out. It's a fundraising event, so we can continue to do the research and the work and support and fund the programs that we support, and to just make this whole March of Dimes move.
Ed, you work a lot with the volunteers.
Yes.
And I mean, there are people who are trained to go out and do educational, but usually the fundraising part is very big, because the research that needs to be done can't be done without that.
Right.
And you know, I know my first volunteer leadership, you know, I was standing on a corner. I stood on the corner of Glenwood and Laurel and collected with my little, you know, can. And
right.
I've been chairman of the campaigns and everything throughout the years. But, you know, I think that just the small ways, you know, you have organized ways, motorcycle rides, and,
Right.
you know, different things to do it, but also schools. How can schools, I think schools get involved, don't they?
Well, we're trying actually to get the schools more involved, yes. There's no age limit on walk teams. I guess we can talk about walk primarily, because that's what's coming up. We have teams of people that get together. We have a captain of a team, and then they put together their own walk team. My daughter, who is 11 right now, when she was 10, she had her own walk team. And she collected, you know, nickels and dimes from her friends, and that got her started. Obviously, you know, you move it up a little higher into the junior high and the high school levels. We would want more teams. We always have a group of cheerleaders at the Walk America, so that's one way that we get some of the high school students involved. We have a high school level volunteer group that we're starting to put together again in the Springfield schools. So we really have we have something for every age group.
You have something called an ambassadors program too. What is that? I mean, that families that go out, or?
Well, yeah, we pick an ambassador family for each one of the events, or they come forward to us and say, we have, you know, here's our baby. Without the March of Dimes, we have found out that this is one of the reasons the baby survived, because of the funding that's been
So they tell their
provided.
success stories.
Exactly. So they'll go out and talk to groups that are interested in this, and they'll exactly talk their success story, bring the baby along, and see that this is the fruition of all the hard work of everybody. This is what, you know, this is why we raise the funds, this is why we support the programs, this is why the research is done, and this is the end result. You have a healthy baby.
You don't do this alone. And just like Dr. Krause, you have about 3 different titles, you know, with the March of Dimes, with the medical school, you know, with the hospital, with the perinatal center. Who all are the partners? I mean, some of those I know are, but who partners with March of Dimes that you know, get the message out to people and do the work?
Well,